Hey, it's Birdman hanging out here in the studio. It's time for a Summit Healthcare's, and I've got with me Kenna Allen and Angie Fabian with Summit Healthcare. Right off the bat, I want to hit the fact that we're sitting in close proximity of each other, closer than 6 feet. And that has to do with the fact that we've been in close proximity. I've been working with Summit Healthcare since the beginning of this. Much like a family, you're going to have a certain amount of people that you're going to interact with. And that doesn't, we're not expecting people at home to start, being 6 feet apart from each other, are we?
No,
no.
We're not.
So that's one thing we want to address. The other thing we need to address is the fact that, yes, there is.
Summit Healthcare did receive a confirmed COVID case today. And we shared that with the community this morning in partnership with Navajo County.
Okay. That confirmed, yes, that's in the area. We're in the area. It's in every area. It's widespread in Arizona. That means it's everywhere. You're not going to avoid it unless you stay at home.
Exactly. And when we say confirmed, we're a confirmed test. We conducted a test. It came back positive.
Right. And so one of the concerns that has been going on is the availability of actual testing. And when you take a look at the constraints that are upon healthcare workers right now, tests are being isolated to 3 groups. Somebody with severe symptoms, somebody that is a healthcare worker with significant symptoms, and people that live in group settings. And so there's a lot of people that present with presumptive symptoms that probably do have coronavirus, that we do not have a positive test result on because they didn't meet that test criteria. I think it's also important to note that we have 3 prevalent viruses in the community at this time. The flu, we saw a resurgence of the flu. We have 2 pneumonia viruses out there as well as the COVID. All of them present with the same symptoms: body aches, fevers, respiratory issues. And so the bulk of the testing that we were doing at Summit on patients with presumptive symptoms were coming back negative.
Right.
Okay, this is the very first positive result that we've had come back.
Okay, and just to understand, because a lot of people really get the idea that they're being told to stay at home to keep them from getting it. And the thing is at some point, almost everybody is going to be exposed to this. All we're doing is slowing down when.
Correct. Because
you only have so many hospital beds, so many respirators, so many of those ventilators, those kind of things, correct? Okay. Right. So what other things come into play now that this is happening? You actually were already in play. You were talking about doing some things at the hospital. And
Yep, as we mentioned yesterday on the podcast, that we're putting up our tent, our emergency preparedness tent, for patients who come into the ED to be triaged outside prior to entering the ED so they can go in the correct locations. And then Ken has a good plan working with our providers.
Sure. So I think, when you look at international studies, you look at national, state, and now down to county, you see certain kinetics of how this virus acts. And based on that, we expect a surge in the near future. And with that surge, we anticipate that individuals will need health care resources. And so what we're trying to do now is we're trying to preserve those resources. So within Summit and with our employed physician network, what we've done is we've taken our providers, we divided them into 2 teams. One team works 7 days on, 7 days off, so they have a period of self-isolation to help to somewhat quarantine them. We are, our primary focus is to ensure that people have access to care. We have 5 sole communities out there where we're the only healthcare provider in that community, so we want to maintain a presence out there. But if we get to a position where we are having difficulty supporting both providers and as well as staff, then we will contract back down to the Summit community. So we always intend to have an outpatient practice open to provide primary care, to provide chronic care, to manage chronic care symptoms, because the literature shows us that people that have uncontrolled risk factors have a higher mortality. And then we will always keep one of our urgent cares open to take the demand off the hospital. So what we've done is we've broken our group, our physicians and their support staff into 2 teams. We've expanded our coverage to 7 days a week. In all of our communities, we're going to be open from 7 days a week, 8 a.m. to 6 p.m. You may not see your doctor, but you will see a doctor or a provider.
Right.
Okay.
And this is at the outpatient pavilion.
It's at our outpatient pavilion. We have that same schedule in our Snowflake community. In Snowflake, we've already consolidated our 2 practices into one. We will keep a walk-in clinic open in Heber. We have 3 providers and a walk-in service in Eager. We have a brand new practice in St. John's and a brand new practice in Holbrook, and we will keep primary care open for that, but we will keep an urgent care open. We will have 3 urgent cares open in our geographic or in our service community.
Okay. And, you know, it's just that people are asking still. They're going to want more information, and especially sitting at home, we get it. You know, you're going to like come up with more things to think about.
Sure.
They keep asking, like, you know, who do these people been around? What have they been? It doesn't matter at this point. It's everybody's been around enough. We now need to keep them apart to keep the spread from happening. So whoever you've been around. Isolate yourself as much as possible. If you're going to go out, don't go shopping. It's not the time to go shopping. Go get the essentials that you need to live for through the end of April, and done.
Yeah.
Yeah.
General precautions. You know, if people follow general precautions, wash your hands frequently. You know, I can tell you with our support staff, what we're instructing them to do. You know, wash your hands whenever possible. When they come home at night, immediately upon entering the house, disrobe, put those clothes in a bag. Take a shower, strong shower with soap and water. Take the clothes, wash them on a hot water cycle, dry them on a high heat cycle. That helps break down the proteins associated with that. And I would suggest the same thing for people to go out in the community. I can tell you that for patients that are going to be using Summit facilities, we are screening at the door.
Right.
So we're screening for, prevalent signs and symptoms associated with COVID. We are monitoring temperature for those people with respiratory symptoms. We're putting appropriate masks on them. We're escorting them to their rooms. We're trying to limit, if not eradicate, our waiting room. We're actually pulling patients from their cars into the actual exam rooms. We're trying to reduce exposure. By reducing exposure, you reduce the rate of spread, and we're trying what they call flatten the curve.
Right. So, and another thing, restaurants. People are still going out to restaurants and they're doing the takeout stuff. So I'd tell you to do this, and tell me if this is bad logic or if this is okay logic or whatever. That if you're going to restaurants and you're supporting restaurants, you've been doing that for a while, fine. Don't expand the number of restaurants you're going to. Go to the ones you've been going to because you've been already interacting with those people. Got it. They're taking as many precautions as possible. But if you start exposing yourself to it, if you've gone to 1 or 2 places and now you're like, oh, I haven't gone to that one. Somebody else is going to that one. Trust me.
Yeah.
Just don't do it.
Right. Now's the time to kind of shrink your circle. Keep your circle within close distances to your home. Stay within familiar surroundings. I think that's a good suggestion.
Very good. Yeah. And I added, creating handshakes since '99 on my cards, and now it's we're not handshaking. So even though I've been around these, they're still not doing that. So yeah, it's just limiting that exposure, because even though we're around each other, we still trying to be cautious, wash your hands and everything like that. It's like every moment afterwards, you grab this stuff and go.
If you can find it.
If you can find it, and luckily I've got a stockpile from all these shows I've attended.
And that's actually a really good point. So, we talk about protective equipment, and at Summit, we have done a very good job of supplying protective personal equipment. It's something that is critically important. It's something that we preserve with our lives, but we have enough protective equipment to not only protect our staff, but to protect our patients.
And not to put you in a spot, but off the top of your head, can you think of some that have been donating to the masks and stuff like that maybe we could call out and say thank you?
We've had a donation from Harbor Freight. They donated some masks. A lot of community. Sylvia Allen definitely has donated. Yep. But we've had a lot of community step up and donate masks and give us supplies as needed.
Yeah, I heard actually on the governor's call that Blue Ridge was actually 3D printing them, so that's pretty awesome.
They are.
I noticed that when I walked into work this morning, there was a small basket over to the side where somebody overnight had actually made a series of masks, put them in a sealed plastic bag, and laid them at our doorstep.
Very awesome. Cool. Yeah. Anything else?
No, I guess I would just give reassurance that we will always continue to provide primary care. We'll be able to address those issues because primary care issues won't go away. Chronic care issues will remain. We'll manage those risk factors to reduce mortality, and we will then support emergency care to make sure that we're available to the community when they need us.
Very good. Thank you very much. Any other questions, of course, post them up. And, you know, they're doing everything they can here. So as I've said on this show from the beginning, wash your hands
Wash them.
and be healthy.